Hello everyone, welcome to my channel Nurse Educator. In today's video, let us discuss about vital signs. What are vital signs? Vital signs are the cardinal signs or vital parameters or signs of life. Okay, they are very important signs of life. They are called as vital because they are governing our body or regulating and controlling our body. So that's why they are the important signs. If you go to hospital, the first thing in the hospital is done is checking the vital signs. Okay, there are 4 vital signs. The first is temperature, pulse, respiration and blood pressure. The 5th vital sign is called as pain. In emergency condition, oxygen saturation and blood glucose level are considered as 5th vital signs. The sequence for obtaining vital signs in newborn is respiration, pulse, temperature and blood pressure. During routine examination, okay, in routine checkup time, we check the pulse, vital signs as temperature, pulse, respiration and blood pressure. In emergency, pulse, respiration, blood pressure and temperature. We are seeing what is temperature. Okay, the temperature is the balance between heat production and heat lost. Okay, uh, the heat which is produced in our body and which is lost from our body, it is a balance between them both. Okay, the degree of heat that is maintained by our body is called as temperature. It is taken by 2 ways. The first is core temperature and the second is the surface or skin temperature. The core temperature is nothing but a temperature of deep tissues. It is more reliable and accurate measurement of temperature. Examples are oral cavity, ear canal or tympanic membrane, esophagus, rectum and vagina. The surface temperature or the temperature which is taken by the skin, it is less reliable because of the surrounding changes. Okay, the temperature can also be changed here. For example, axilla and forehead temperature. The thermogenesis. Thermogenesis is called as heat production by the oxidation of food. Okay, if you eat food, the kilocalories are burned. Okay, so the heat is produced in the body. Thermolysis is heat which is lost from our body in the way of skin, radiation, evaporation, conduction through lungs, kidney and bowel. The heat is lost. The heat regulatory center in our body is the hypothalamus. Heat production is regulated by posterior part. Heat lost is regulated by the anterior part. The temperature which is taken from various sites, okay, are the mouth is the most common route, which is measuring 98.6 degree Fahrenheit. Axilla, most common site in children's, 97.6 degree Fahrenheit. Rectum is most accurate, 99.6 degree Fahrenheit. Tympanic membrane is also 99.6 degree Fahrenheit. Temporal artery is 98.6 degree Fahrenheit. When the temperature is increased, it is called as fever or pyrexia. Okay, the fever or the temperature more than 38 degrees centigrades or 100.4 degree Fahrenheit. The normal body temperature is called as euthermia, that is 98.6 degree Fahrenheit or 37 degrees centigrades. Hyperthermia, when the temperature is increased more than 105 degree Fahrenheit. Hypothermia, when it is decreased less than 95 degree Fahrenheit. Okay, the temperature is taken by thermometer. So here you can see some pictures that these are the clinical thermometer, digital thermometer, tympanic membrane thermometer, infrared thermometer, rectal and disposable thermometer. Okay, so some of them can be used in hospital too. Then we'll see what is pulse. Pulse is nothing but alteration or change in the rise and fall of an artery by the wave of blood. Okay, whenever the heart is contracting in the left ventricle, so the heart, there is some changes in rise and fall of the artery. It is also known as heart rate. Usually it is felt whenever the artery is crossing the bone surfaces. We use 3 fingers to assess manually the pulse, that is the first finger, middle finger and the index finger. We keep it on the wrist. Okay, the method we are using to assess it is called as palpation method. The pulse should be checked fully for 1 minute. Okay, that is 60 seconds, except at the site of carotid pulse. Do not measure the pulse for 30 seconds and then multiply it by 2. Okay, you should assess the pulse fully for 1 minute, that is 60 seconds. Then the sites for taking the pulse. Okay, starting from temporal. Okay, temporal, we'll assess it at the lateral aspect of the eye. The second is the carotid. We'll assess at the neck or sternocleidomastoid muscle. Okay. The third is apical pulse. It is the most accurate site for assessment at the apex of the heart. Okay. The brachial is above the elbow in the antecubital fossa. The next is the radial. We'll check the radial pulse at the wrist. Okay. Femoral at the groin region. Popliteal just back of the knee in the popliteal fossa. Dorsal pedis in the median aspect of the foot or in front of the foot. Then the posterior tibial, that is inside of the ankle and behind the medial malleus. Okay, these are the different sides of taking the pulse. Okay, so from head to toe, you know what are those. Okay, that is temporal, carotid, apical, brachial, radial, femoral, popliteal, dorsal pedis, and posterior tibial. Then we'll see what are the characteristics of the pulse. The rate. The first is the rate, the number of pulses per minute or beats per minute. The normal pulse rate in adult is 60 to 100 beats per minute. Average is 72 beats per minute. The normal pulse rate in newborn is 120 to 160 beats per minute. When it is increased more than 100, it is called as tachycardia. When it is decreased less than 60 beats per minute, it is called as bradycardia. Okay, we should check pulse in supine position. The second characteristic is volume. Volume is nothing but the fullness of the artery. Whenever the artery is full, or it is the force of blood is felt in each beat. Okay, we'll also see stroke volume. Then the next is rhythm, the regular pattern of a pulse in which the time frame or regularity of heartbeat is called as rhythm. Okay, thanks for watching the video. The other vital signs we'll be discussing in the next part. Please like, subscribe and share.